Hello and welcome to your open enrollment presentation presented by Walsh Duffield. A couple of key things to remember before we get started, and we'll go over them again as we go throughout. Open enrollment dates. So if you elect to change coverage, you have the window of October 28th through November 8th to make any of those benefit changes. Your benefits are going to be effective between January 1st through December 31st of 2025. And unless you have what's called a qualifying life event, the elections that you make at this time will be for that full 2025 plan year. Today we're going to be reviewing your medical benefits available through Independent Health. You have an option of 2 different spending accounts. You have non-medical plans available to you, and then we'll wrap it up with some next steps. Starting first with your medical plan. Some commonly used terms. So starting with that annual deductible. That is the amount of money that is your responsibility, that negotiated amount after a claim has been submitted by a provider. That is your deductible portion, is the amount you're responsible for before the plan starts paying. Co-insurance and copay after having met the deductible, or if your plan is not subject to a deductible. Those are the portions of the claim that you are responsible for. A co-insurance is a percentage of those allowed dollars, and a copay is a fixed dollar amount. EOB, explanation of benefits. So again, with every provider or facility visit, they are going to submit a claim to Independent Health for remittance, and once that has been processed, they are going to prepare an explanation of benefits that's going to show you what the date of service was, who the providers were, what was done, and what is going to be your portion of the responsibility for that claim, as well as what the plan pays. And then out-of-pocket maximum, that is just the total amount of money that you can pay out of pocket in any plan year before the plan picks up 100% of the expenses for the rest of the year. Again, in 2025, you have the option of 3 separate plans. Starting on the far right-hand side, we're looking at that Encompass Plus plan. If you look at the first row, you can see that the deductible is NA, meaning that there is no deductible to be met before claims are copay or co-insurance. Medical services, so primary office visits, are going to be $25 for an adult on day 1 and $0 for a child. Specialist visits are $40 for an adult, $0 for a child. Laboratory services are covered in full. Diagnostic x-rays, again, have a separate copay, whether it's an adult or a child. Therapy, so physical therapy, occupational therapy, or speech therapy that is processed through the health plan is going to be $40 per visit. Moving down to hospital care, inpatient hospitalizations are $500 per admission. Outpatient surgery facilities are $125 per service. Emergency room visits are $150 and urgent care visits are $50. Prescription drugs are a $10, $30, or $50 copay depending on the tier of medication that you are having filled. There's also an additional benefit of an annual routine eye exam that is a $0 cost to you. Out-of-network benefits are available, and this on the Encompass plan does have a deductible to be met. So if you are enrolled as an employee only, it's $1,500, and then services become a 25% co-insurance. If you're enrolled on a family plan, it's a $3,000 deductible and then a 25% co-insurance. And the out of maximum cost on each of these 3 plans is $10,000 if you're an employee only enrolled in the plan, or $20,000 if you're a family. Moving to the left, you have the 2 HSA qualified high deductible plans. The one in the center is the $3,000 deductible plan. So that has an annual deductible of $3,000 for all services prior to transitioning over to a copay. If you're enrolled as a family, It's a $6,000 deductible before, again, moving over to a copay model for medical services, hospital care, and prescription drugs. There is out-of-network coverage here that is a combined deductible. So in and out-of-network deductible is $3,000 individual, $6,000 if you're enrolled as a family. And then out-of-network benefits are a 30% coinsurance after meeting that deductible. On the farthest left is the other HSA qualified plan. This has a lower deductible to be met. So for 2025, it's a $1,650 deductible if you're enrolled as an employee only, or a $3,300 deductible if you're enrolled in a family plan. Again, services once meeting that deductible move over to a copay. You have that embedded combined deductible for the in and out of network benefits. Again, $1,650 for employee only enrollees and $3,300 if you are enrolled as a family. And this one has a 25% coinsurance once meeting that deductible for out of network services. No matter which plan you elect, though, there is no cost preventive care. We really want to make sure that individuals are engaging with their primary care providers, getting those routine physicals, having that annual lab work done, getting those immunizations on a regular basis for both pediatrics and adults for flu shots, COVID vaccines, and the like. If you have any questions about what is considered a preventive visit, you can visit independenthealth.com. And when you click on that site, you're going to have the opportunity to find the preventive services, both age and gender appropriate. The hierarchy of care. So we really do want to make sure that if you have an emergency, you're finding the most appropriate avenue of care. True emergencies, there are no questions. We want you to get to that emergency room. But you do need to know that this is going to be the most costly avenue and most likely the most time consuming. If you have the opportunity to transition that care to an urgent care, telemedicine, or even your primary care provider, there are different lengths of time that those visits would cost. Different lengths of time that those visits would take and different costs associated with those. Urgent care visits are going to be a little bit more time consuming. Telemedicine through teledoc is going to be the quickest avenue of service. And then engaging with your primary care provider, we really want that individual to be your gatekeeper and want them to know what's going on with all avenues of health. With the primary care provider, there is the opportunity to potentially go in for an in-person visit or do a telemedicine visit directly with that established provider. With the teledoc, as mentioned on the previous page, you do have that opportunity to meet with a physician from the comfort of your own home. We do recommend downloading this app in advance of needing it. They do want you to create a login. You'll enter your independent health information. You'll put in your preferred pharmacies. Once that is set up, it is a very quick process. You can speak with a primary care provider. If you have something cold, cough, flu symptoms, either at home or on vacation, they can diagnose you, submit prescription requests as well as lab requests. There is a mental health component. You have the opportunity to speak with a provider, either a clinical social worker, psychiatrist, psychologist, or therapist. These are scheduled visits, and you will pick the provider that you would like to schedule those appointments with. These visits are a $0 copay after meeting deductible if you are in one of the two HSA qualified plans. And then lastly, there's a dermatology consultation. This is an opportunity that if you cannot get into a local dermatologist, you can upload some images, you can put in some symptoms that you are having, and you will have a dermatologist respond to you with a course of treatment. This service does follow your specialist copay or coinsurance after meeting the deductible in either of the two HSA qualified plans. Independent Health just wants to know that they do have you covered throughout New York State and into Pennsylvania with in-network providers. So starting with those bright red 8 counties of Western New York, you have access to all hospitals, all labs, including Quest, and more than 98% of Western New York physicians are considered in-network providers. Once you move into those darker red bands, those counties either in New York State or in Pennsylvania, you do have access to additional hospitals. So in those regional New York State counties, you have access to 11 different hospitals and more than 9,000 providers. And in those 4 highlighted counties in Pennsylvania, you have access to 6 different hospital systems and more than 1,200 providers being in network with Independent Health on your plan. Member tools. So in addition to that teledoc, if you were to download that, you do have the opportunity to access your Independent Health benefits either through the website or through the app. It's going to be one username and login that's going to give you access to both avenues. And on that, you can see, understand your benefits, what benefits are available to you. You can look at all of your claims and explanation of benefits. If you're in one of those 2 high deductible plans, there is a deductible tracker. So it's going to keep track of how closely you are to meeting that deductible for the year. There's also a Find a Doctor tool, as well as you can have the opportunity to chat with a live registered customer service individual. So either avenue, either the app or the website, are both great resources to help you understand your benefits. All right, starting with those wellness resources. Again, in 2025, Independent Health is continuing that Red Shirt Rewards. This is an opportunity for you to earn up to $30 in rewards in $10 increments. And it's for both you, the employee, your spouse, and any dependent children over the age of 18 are each eligible to get these gift cards. So how it works, once you're logged into the MyH account, you're going to activate the program. And you do need to activate this on an annual basis. So if you have not done so yet for 2024, there is still time. You can activate it. And if you had any of these qualifying services in 2024, you'll receive an email notifying you to sign up and elect one of your rewards. For 2025, it's going to reset. So on January 1st, on or after, you can again activate the program. Once you receive that email that you have completed one of the eligible services, make sure that you do choose which reward you would like. You don't need to use that reward right away, but there is a time limit. Once you receive that email notifying that you have an eligible reward, you do need to select that reward, and then that can stay in your account and you can use the gift card at any time after that. If you do have any questions on the Red Shirt Rewards, you definitely can contact Member Services, either telephonically, through the app or website, or through emailing them at memberservice.com. It works again for the 2025 year for 2026 benefits. So this 2025 program started October 1st of this year and runs through September 30th of 2025. You must complete all the required challenges and any additional challenges to get up to that point threshold. Those 3 required challenges again are that annual well visit, a preventive service, and then watching the prevention and lifetime screenings video. Additional challenges throughout the year. You are going to have different quarterly challenges, lunch and learns, and videos that you can watch. You also can have a dental or vision exam and submit that claim into the program for points. You can complete the well-being assessment, any of the other activities that are employer sponsored. Or if you have that annual well visit and need that routine blood panel, that routine blood panel does count as one of those additional challenges. So you really want to make sure there's a lot of avenues for you to get those points and complete this FitWorks program for 2025 and those benefits for the 2026 plan year. Moving on to those spending accounts you have available to you. If you are enrolled in either the HSA qualified high deductible plans, you can open up a health savings account. You have the opportunity to open this with any bank that you prefer, or you can do it through Health Equity, which is an independent health company, and it would be embedded within the independent health app or the website to view and see your balances. For 2025, the contribution limits, and these contribution limits are both employer and employee totals. So the company does provide funds into your HSA account. So if you are enrolled in an employee only plan, as a single, you can contribute up to $4,300 into an HSA for 2025. The company is going to put $500 into your HSA, so that does decrease that maximum contribution limit to you. For a family, if you're enrolled in a family plan, your maximum HSA contribution is $8,550, and the company here offers a $1,000 contribution into your HSA account. What are some of the advantages of an HSA? First and foremost, these are tax-free dollars that are funding into this HSA to be used for eligible medical, dental, vision, hearing expenses. These accounts are yours. They stay with you. If you leave the company, these accounts go with you. And year after year, these funds roll over, so there is no expiration date. You can contribute up until the age of 65, and once you turn 65, you can no longer contribute, but you can use these funds still to use for any eligible expenses. You can also use them to pay for Medicare premiums once turning 65. Flexible spending accounts, there are two options available to you. The first that we're going to review is that medical care FSA. So for 2025, the current maximum is $3,200 that can be contributed into this account. This is offered through Nova, and you'll have a Nova credit card, debit card to utilize for any eligible expenses. Again, pre-tax dollars that you are contributing into this account, but they are use them or lose them dollars. So you really want to make sure that you are not overfunding this account. If you currently have an FSA account today in 2024 and you have dollars left over, make sure you spend those dollars to below $640, and that $640 will roll over into the 2025 FSA balance. It does not count towards your maximum contribution. The rollover is separate. Any funds over $640 are forfeited after the runout date. So you really want to make sure that if you have extra dollars in that account, make sure you've reimbursed yourself for any eligible expenses. If you still have more dollars, again, there are avenues online, Amazon, FSA store. Really stock up that medicine cabinet and make sure you spend those dollars because you don't want to lose them. If you have an FSA and want it again in 2025, you do need to re-enroll. The last thing I do want to mention, in the center of the page, the flexible spending accounts are front-loaded. What this means is that if you elect to have, say, $1,000 put into your FSA, on January 1st, that full $1,000 is going to be available to you to spend, but you're going to be reimbursing the account throughout the year through payroll deductions. Again, pre-tax dollars coming out, all of those dollars are available to you on day one. So just real quickly, additional healthcare eligible expenses. So whether you have an HSA or an FSA, you can use them for medical, you can use them for prescription expenses. You can also use them for dental, vision, hearing, and as I had mentioned, there's a whole store of FSA eligible items that you can spend those dollars on. So whether it's an FSA or HSA, you do have additional avenues to spend those dollars if you need to use them. The other flexible spending account you have is a dependent care FSA. So for 2025, the maximum contribution here is $5,000. This is again a use it or lose it account. There is no rollover. So if you enroll in this, you do need to make sure that you're going to be using these dollars for eligible dependent care expenses. This is not front loaded. The thought being that because it's dependent care, you're not paying for daycare or preschool all up front. You're paying it throughout the year, and as these payroll deductions are coming out, pre-tax and funding this account, then you can pay those expenses. I do want to note in the bottom, that last bullet on the right-hand side, the IRS also offers a tax credit for dependent care expenses on your annual return. You can claim either the dependent care pre-tax account or the dependent care tax credit on your annual return. You cannot claim both. So if you do have any questions, make sure you talk to your tax advisor and see which one is going to be most advantageous for you. Some of those eligible dependent care expenses, so it's including but not limited to. So if you have a child under the age of 13, you can use it for before or after school. You can use it for nursery, preschool, daycares. You can use it for day camps, holiday camps, late pickup fees. What you cannot use it for is private school tuition. So once they've graduated from preschool and are enrolling in kindergarten, you cannot use it for any private school tuitions. You cannot use it for any registration or application fees for nursery schools, preschools, daycare centers. You can use it for day camps. You cannot use it for overnight camps. And expenses are for non-disabled children under the age of 13 or disabled children 13 and older and any dependent adults that you are responsible for. All right, moving on to those non-medical benefits, starting with the dental plan. These are offered through Guardian, and it's a PPO preferred network. And you can see we have two different columns here. There's an in-network and out-of-network benefit. Both have a $50 or $150 deductible, depending whether you're enrolled as an employee only or as a family. Both cover preventive care 100% in full. I do want to make a big caveat here. In-network providers are going to take that full negotiated amount, and that is no responsibility to you then for preventive care. Out-of-network providers, they are going to bill Guardian. So for that preventive service, say that both in-network and out-of-network providers billed Guardian $150. That negotiated amount is $100. With that in-network provider, they're going to take that $100 payment, and that's the end of the day. With an out-of-network provider, they are going to take that $100 payment, and that is that 100% covered, but you will be balance billed for that difference between the negotiated amount and what that provider billed. So just make sure if you are visiting an out-of-network provider that that is the opportunity that even though it's covered in full, 80% covered, 50% covered, there is that balance billing with those out-of-network providers. Orthodontia coverage is up to 50% with an a lifetime maximum benefit of $2,000 per person for dependent children up to the age of 19. There is a calendar year maximum benefit for those basic and major procedures of $1,500 per person. There is also a rollover benefit. So if you're enrolled in the plan in 2024, you have not used your maximum benefit of $1,500, there is likely going to be a rollover into your 2025 balance. So in addition to that 1,500, you can have a rollover. The maximum rollover account limit is $1,250. So you may not have used your dollars year over year, and at maximum, you can have $1,250 roll over into the next plan year, in addition to that calendar year maximum benefit of $1,500. Vision benefits, again, in and out of network benefits through Guardian, their full feature designer plan. So in network benefits, the vision exam is $0 copay. Your lenses, depending on single, bifocal, trifocal, or lenticular lenses, are a $0 copay. Frames, the responsibility is 80%, any amount over $130 that's covered. Contact lenses for elective or disposable contact lenses, 85% of the amount over $130. Medically necessary lenses are covered in full. Out of network, it is a reimbursement model. So you're going to have that vision exam at an out of network provider. You're going to pay for that service at that time of service. You're going to submit your receipt into Guardian, and they will reimburse you up to $50 for a vision exam, up to $126 depending on what type of lens you have. Frames is the same reimbursement model. The frequency of services that you can have. So an eye exam is once every calendar year. The lens and contacts is an either or benefit every year. And then the frames are every 2 years. So what that means is if you have, again, the vision benefit in 2024, you got new frames and new lenses this year. Next year, you can use that benefit to get contacts and use that benefit. Or if those lenses just maybe are not working out for you, you can have new lenses put into those frames that you got in 2024. You cannot use the lens and the contacts benefit in the same year. So that is an either or, and the frames are every other year you can have that benefit. Moving on to some of the insurance policies. So starting with the life insurance policy. This policy specifically is 100% employer paid. The coverage amount is 200% of your annual salary plus an additional $15,000, and there is an accidental death and dismemberment rider attached. If you go down to the third from the bottom, accelerated life benefit, what that means is if you're diagnosed with a terminal illness, you do have the opportunity to take an advance on that coverage amount to utilize for whatever you would like prior to your death. The caveat is upon your death, whatever amount that you took out in advance is going to be decreased by that decreased amount is going to be given to your beneficiaries. If you were to leave the company, there is a conversion and portability option that you can submit an application to Guardian and then pay those premiums directly to the company. There is also a voluntary life insurance policy that you can elect to have coverage for, both for you as the employee, your spouse, and your dependent children. The coverage amounts are in $10,000 increments as the employee, $5,000 for the spouse, and it's a flat benefit amount of $10,000 for dependent children up to the age of 26. You can see the maximum benefits for employees is $500,000. Spouses, it cannot exceed 50% of your employee coverage. And then the guaranteed issue. So if you did not elect this coverage when you were first hired, you will have to complete what's called an evidence of insurability form. It's a quick questionnaire that you're going to complete, which is going to be submitted to Guardian's underwriters. If they have any additional questions, they will send that to you for more health screenings. Otherwise, they will approve your policy and those premiums will be deducted. There is a waiver of premium on this benefit, meaning that if you are to become disabled, you do have the opportunity to submit a request for waiver of premium to continue the coverage without having to pay the premiums while you are disabled. The reduction schedule, if you're still employed or still have this policy in place, at age 70, the benefit amount does decrease by 50%. There is also that accelerated life benefit on this policy as well as the conversion and portability, meaning that once you have this coverage and you leave the company, you do have the opportunity to take it with you. Disability insurance, this one is 100% employer paid, and this is the long-term disability policy. So this is a 60% of pre-disability earnings up to a monthly maximum of $5,000 benefit. The elimination period is 180 days. So if you have short-term disability, that will take you right up to this 180-day mark, and then at that point, this benefit is going to kick in. And if you are permanently disabled, this benefit will continue paying until your Social Security natural retirement age. So that could be 65, 66, or 67, depending on your current age. This tax treatment, so if you have this benefit, it is a taxable benefit. So make sure that you have those taxes deducted from that or pay them at the end of the year with your tax return. Some benefits that you do have available to you: New York Disability. So this is that mandatory benefit that has a maximum weekly benefit of $170. The elimination period here is 7 days. So on day 8 of being out of work, it will start coverage, and the benefit duration is 26 weeks. You are making a small payroll contribution for this benefit. Again, it's New York State mandated. The supplemental short-term disability. So that long-term disability is company paid, but if you wanted to elect additional short-term disability on top of that New York DBL policy, you can have coverage. Weekly benefit is 60% of your pre-disability earnings up to a maximum of $2,500 per week. Elimination period for short-term disability is again that 7 days, same as the policy above. So on day 8, it starts paying, and the duration is 25 weeks. Again, tax treatment is a taxable benefit. So if you are out on disability, make sure that you're having taxes taken out or you're setting aside those dollars for your taxes. New York paid family leave is available to you currently. And this benefit, if you are qualified, is a weekly benefit of 67% of your average weekly wage, with a weekly maximum of $1,177.32 for 2025. The benefit duration here is 12 weeks, but there is no consecutive requirement. So if you are qualified for New York State paid family leave to take care of a newborn or a loved one, you can take this time as needed. So if you need to take a half a day, a full week, you can do that up to a maximum of 12 weeks within a 52-week period. Again, there is an employee contribution through your payroll deductions, and that for 2025 is going to be an annual maximum of $354.53. Starting in January 2025, there is going to be an additional paid prenatal personal leave. So individuals who are pregnant may have additional paid time off available to them for doctor's appointments, procedures, and any other type of prenatal care. This will have more information once we get into 2025. So if you have any questions, make sure you reach out to the HR team. Voluntary critical illness and voluntary accident insurance. These policies are, you're going to see, medical related, but they are separate from your medical insurance. So this first one is that the critical illness. So you can see those covered condition examples at the bottom. You have the opportunity to elect coverage in either $10,000, $20,000, or $30,000 benefit amounts. You can also elect coverage for your dependents, spouses, and children. If you are diagnosed with cancer, The medical plan, independent health, is going to cover those medical expenses. So you're going to have those claims submitted to independent health. You're either going to pay deductible, co-pays, co-insurance for that claim. If you have this policy, you're going to submit an explanation of benefits to Guardian, and they are going to pay you a check in the amount of coverage that you have elected. These dollars are meant to offset any expenses that you would like to use them for, whether it's to pay for co-pays, the time off that you may have had to take for work, whatever you would like those dollars to be used for. There is also a wellness component. So at the bottom, if you are enrolled, your spouse and your dependent children are enrolled. If you have that preventive exam, so you're doing it for FitWorks as the employee, you also can submit that explanation of benefits into Guardian if you have this critical illness policy and receive an additional $50 payment each year for getting that preventive visit. The voluntary accident insurance is just that. You have an accident. So say, for example, you have a bad fall, you break your leg, you have to be taken to the hospital by emergency room or the emergency room by ambulance. So medical plan, independent health, or whatever coverage you have is going to pay for those claims. You're going to pay the copay, you're going to pay the deductible expenses. That is separate. This policy, once you get that explanation of benefit, you're going to submit those into Guardian, and depending on what the fee schedule is for a broken leg, you're going to receive a check. That ambulance ride, you're going to receive a $200 check. That emergency room visit, you're going to receive an additional $200 check. Again, additional coverage just to help cover any expenses that you may have. Lastly, the Employee Assistance Program is available to you. On the right-hand side, there's a QR code, an 800 number, or you can visit the website. So there are a lot of resources available to you if you have questions about legal issues, losses, if you have any questions about elder care or child care locations, if you have legal questions, there are resources available to you by contacting these the EAP and getting those questions answered for you. All right, wrapping up. So for 2024, if you do not want to make any changes for 2025, your benefits that you have right now will automatically roll over, with the exception of the FSA. I had mentioned early on that if you are currently in the FSA and want to have the FSA again for 2025, you do need to re-enroll and elect the dollar amount that you would like to have funded. Employees that want to participate in the opt-out program, you also need to go through the open enrollment and do the opt-out. It will not roll over from 2024 if you're not taking benefits into 2025. If you go into the open enrollment system, we really want to make sure that your beneficiaries are up to date. Make sure that everyone that's supposed to be covered is covered. This is your opportunity to do that. So between October 28th through November 8th, this is that open enrollment window. And the plan benefits are going to be in effect from January 1st of 2025 through December 31st of 2025. Unless you have a qualifying life event, you cannot make any changes. A qualified life event is having a baby, getting married, getting divorced. If any of those or other qualified life events do happen, make sure you contact HR within 30 days of that event, and all of your benefit windows will reopen. So you can elect additional coverage, you can elect additional life insurance, either the dental, vision, critical, or accident insurance policies. All of those reopen up to you. How do you do that? You log into Paycor. From there, you're going to click on the People drop down, the Benefits, and then over to Benefits Advisor. It's going to take you another page, and you're not going to have to be asked to log in again. It's going to take you right over, and you can go through the windows and make your elections for 2025. If you have any questions, you can reach out to either to Mia or Donna Marie, and they can answer those questions. And if there's additional questions that they can't answer, they do know how to get in touch with me. So thank you so much for listening today, and have a wonderful rest of your day.